Welcome! The virtual event will begin shortly. Let's get to know the virtual event environment. At the bottom of your screen, you'll see a row of icons, each with a unique function. Icons vary from event to event, so you may see some or all of the icons covered in this video. This is the Restore icon. It will restore all of the windows to their original positions. The video and slides icons allow you to minimize each window and customize your screen. Click on the group chat icon to connect with other attendees. The Q&A icon is where you can ask questions to the speaker or ask for technical help. Just type your question into the box and submit. You'll see a brief confirmation message when you do. Click on the summary icon to read the event summary and on the speaker icon to learn more about the event speakers. When you click on the resources icon, you'll find additional information pertaining to the event. And last but not least, if real-time closed captioning is available, use this icon to follow along throughout the event. If you have technical difficulties, here are a few tips that can solve some of the most common issues. If you don't see the video or hear the audio, try refreshing your browser. If you can't hear the presenter, verify that your speakers are turned on and the volume is turned up. The platform works best when watching on a computer or laptop, not on a smartphone or tablet. If you have a weak internet connection, try connecting directly to your router with an Ethernet cable. And don't worry if you miss something, because you can view a recording of the event later. All attendees will receive a thank you email following the event with the information you need to view the recording on demand. Enjoy the event!
Hello, and welcome to today's presentation. I'm Karen Cafanteris, Associate State Director for AARP Michigan. I want to first start out by thanking our partner on these diabetes events, Peak Performance Physical Therapy. Peak Performance Physical Therapy is a Lansing area-based physical therapy practice with clinics in Lansing, DeWitt, Holt, and Okemos. So, as you heard during that brief introduction to the platform, I want to draw your attention today to the icon at the bottom of your screen, which is a red circle with two, looks like two pieces of paper in it. That is where you're going to find the handouts. And this is important because during today's presentation, the Dr. Champagne and Dr. Gabriel Champagne are going to be leading us through what the values clarification worksheet. So I need you to click on that, open it up, and save it so that you can work through that during while they're helping you walk through that. And since today's is a in-depth presentation, I'm going to go ahead and introduce our presenters. At the end of the presentation today, I'm going to tell you how you can rewatch the presentation, how you can share it with other people, how you can find other presentations that we're doing here at AARP Michigan. So I'd like to introduce our presenters now. Dr. Champagne is the Director of Behavioral Medicine Education for the McLaren Flint Internal Medicine Program. He holds assistant professor appointments through Michigan State University College of Human Medicine in the departments of psychiatry, family medicine, and internal medicine. He also serves as a board member and supervisor to the MyCAPT Postdoctoral Clinical Health Psychology Fellowship. During his tenure with McLaren and MSU, Dr. Champagne has focused on various forms of behavioral health integration and behavioral science curriculum development. His service line innovations and pedagogy both emphasize biopsychosocial model of healthcare. In addition to behavioral science and graduate medical education, his professional interests have included population health initiatives focusing on community partnership, leading quality improvement efforts, and integrative primary care innovations emphasizing lifestyle modification. Dr. Molly Gabriel Champagne was born and raised in Michigan, a devotee of all things academic and football. She attended the University of Michigan for college and then went on to the University of Detroit Mercy for her master's and PhD in clinical psychology. She completed her postdoctoral fellowship in clinical health psychology and medical education at the Consortium of Advanced Psychological Training at McLaren Hospital through Michigan State University. She is currently the Director of Behavioral Science Education for the McLaren Bay Region Family Medical Medicine Residency, as well as the Michigan State University Psychiatric Clerkship Director for the same hospital. She also oversees the scholarly activity of the residents within her residency and is the faculty mentor chair of the Resident and Medical Student Wellness Committee. Her work currently focuses on training residents and medical students, administrative work within the residency, rounding on the psychiatric consultation liaison service, and curricula development. Well, that was a lot of big words. Welcome to both of you.
Thank
Great.
you.
Thank you so much, Karen.
And I am
Glad to be here.
We're very excited to have you today. So you are the fourth in our diabetes series. We started with prediabetes, went on to a presentation just in general about what is type 2 diabetes. Then we talked about nutrition and diabetes. And now we're talking about behavioral modification for diabetes and making permanent change. So I know you've got a lot of slides and a lot of information to share. I'm going to go away and let you guys get started.
Perfect. Well, I just want to thank you again, Karen, for the invitation, and thank AARP for the opportunity to talk about behavioral modification for diabetes. So Molly and I are both trained classically as psychologists, and hopefully we can bring some of our education and some of our wisdom to bear in kind of understanding some of the elements with behavioral management associated with diabetes. So to set the field, to understand what we're going to be talking about over the course of our time with you, I just want to kind of provide this overview. So we'll start our conversation off by exploring the Behavioral Management 101 skills. We'll talk a little bit about habits, how habits are formed, and how we can kind of create new habits. We'll then transition, make a small pivot. Maya will take over, and she'll talk about the stages of change. This is a model of change that goes across all types of behaviors, so it doesn't have to be specific to diabetes. It could be starting a new skill, but it is a pretty broad model of exploring change. We'll hope to cement that through further kind of exploration and going in a deeper dive with looking at how do you set goals, specifically creating SMART goals. And we'll try to do this in the context of diabetic management. And then we'll wrap things up with exploring some of the common pitfalls, primarily oriented a bit more towards the emotional and psychological well-being of individuals with behavioral management. So my next slide, Behavioral Management 101. To start us off, most of what we do, our day-to-day lives, is really governed by habit. So habit really is kind of responsible for the majority of our day-to-day behavior, our conduct, how we navigate our lives. In fact, a researcher out of the University of Southern California, her name is Wendy Wood, examined the power of habits and identified that approximately 40 to 45% of our daily behavior is all rooted in habit. And I think we could relate to this pretty easily if we start to think about the various activities that kind of fill our day-to-day lives, right? So whether it's finding time for our favorite leisure activity or turning on the television, binge watching Netflix, our diet, our physical activity, how we maintain our day-to-day conduct, all of it is really rooted in habit. And you can see those repetitions once you start to kind of examine the various components of your day-to-day lives. So here, again, research shows about half of our daily actions are driven by repetition and habit. However, the strange part is most people fail by the second day at developing habits. So my question, just kind of rhetorically to the group is, why do you think this might be? Why do you think that we might have such difficulty kind of generating new habits? And I'll give you guys a second to kind of reflect on that and let that sink in. And as we do, I want to kind of transition to talking about kind of the core components of habit. I'm going to go to the next slide here. So to get us kind of rolling, really defining a habit is a well-learned behavior or automatic sequence of behaviors that is relatively situational specific, and over time has become kind of something that is rehearsed and motorically reflexive, which means that it's kind of based in our motor system and independent of motivation or cognitive influence. That is, it is performed with little or no consciousness. So when we think about this, we can think about activities like driving. So I commute to Flint from Bay City, and the commute time from Flint to Bay City is about 45 minutes. But on any given day, you could ask me what that drive was like. And even though I was fully present and fully attentive, avoiding distractions during that drive, one of the things I'm going to struggle with is remembering each kind of individual moment and each kind of piece of that experience, because that drive has become habitual for me. So it's something that is rehearsed, something that is well defined in my experience. So let's do a little bit deeper dive in habits. Habits are pretty complex. So a researcher out of Harvard named Marco Badwell started to explore the idea of habit and broke it down into 4 key components. So habits are really defined by having an initial cue. So our definition explored kind of the situational components of habits, and those are the cues that kind of sync with the operation of habit, the kind of day-to-day piece. So from the cue, oftentimes there's a craving. So if we think about the habit of say going to McDonald's for like our favorite shake or our favorite meal, one of the things that we have after a situational cue, we might see maybe an advertisement or something that cues us in. We have a craving. That's part 2 of kind of developing a habit. The parts that are volitional, or the parts that are active for habit, is kind of the response and reward cycle. So that's parts 3 and 4. So our response is essentially the behavioral reaction of responding to a craving, and the reward is the experience or the pleasure derived from whatever the behavior that we're participating might be. So all of this is really rooted in our kind of our brain system. It's hardwired in our neurobiology. And the way that habits actually work is habits operate on the dopamine in our brain. And dopamine is the neurochemical or the transmitter in our brain that regulates pleasure. So connections and pathways begin to form with neurons in the brain as we have more of this dopamine that takes place. So you can imagine that from this 4-stage habit model, that as we reinforce certain behaviors, as we participate in that craving, response, reward cycle, that continues to kind of build over time, and that pathway becomes more efficient. So the reason why habits kind of build over time and they become so automatic is because the brain is a machine based on efficiency. And the brain tries to conserve as much energy as possible, and it knows that if a behavior is important or an outcome is important, that we want to kind of make that pathway as strong as possible. So actually what you see is as we begin to kind of rehearse habits, as we begin to rehearse new behaviors, the brain starts to change. And one of the ways the brain communicates is through a system of neurons. I imagine a lot of folks on this call understand what neurons are, but they're essentially the nerve signals that communicate from one area to the next in the brain. And what we have when we're developing habits is those nerve cells become stronger and start to kind of increase the fatty tissue around the nerves, called the myelin sheath, that increases the signal, the speed of the signal from that craving, response, reward cycle. So what we see over time is as we participate in habits, as we participate in behavior that's reinforcing, those behaviors continue to kind of build up over time. Let's break down those four components a little bit more in detail, so we understand what each one of them, might look like, and so we can begin to kind of anticipate as we're forming new habits how to strengthen certain elements, or if we're trying to break habits, how to kind of shift gears and turn into a different direction. So in the four-step sequence, the first step is really the cue or the trigger within the habit cycle. So this is the part of the habit loop where you're triggered to take some sort of action through a cue in your internal or external environment. So marketers are really good at kind of pulling on our strings with regard to habits. That's why we have commercials. That's why we have branding. That's why we have clever, slogans and jingles that stay with us, right? This is really what's kind of cueing us in or triggering us in to activate that habit sequence sometimes. And you can see this in a variety of settings, whether it's at home and we're habituated to have a certain kind of dessert after a meal, or whether we're participating in some form of behavior like even positive behaviors, exercise, that once it becomes habitual, you almost have that need to continue to participate in it. Sometimes even seeing things like our workout gear or our weight equipment might trigger that habit cue. So moving from cue and trigger to craving, the second component of the habit cycle, cravings are the second step of the habit loop, and they are the motivational force behind every habit. So all of us can empathize or connect emotionally with, what cravings are like and how cravings, the experience of cravings. This can be from anything like chocolate and brownies to the craving of having, a cigarette for smokers. Cravings are the piece that really propels us forward within the habit cycle. Once cravings are present, oftentimes we unconsciously act on those cravings and participate in the next piece of the habit loop, which is the action or the behavior that gets us the reward. So once we kind of cue in from the cravings to actions, this is when we have the opportunity sometimes to make decisions. This is where we want to slow down the habit loop if we're forming new habits. So good or bad, this is the part of the habit loop where you can take action on the habit. You either want to adopt or drop. And we'll talk a little bit more about this as we continue to progress. Excuse me. The last piece of the habit cycle is the reward. So this is the part of the habit loop where the brain receives a reward for taking the desired activity or participating in the desired activity, or not, as you'll see in kind of some subsequent slides. So oftentimes reward is experienced in the pleasure of the activity or the removal of some sort of adversive experience or some sort of painful experience. So it reinforces the behavior that we're participating in. So this is another kind of depiction of what the habit loop can look like, and it is sequential. So we start typically from cue to craving to response to reward. And really, when we're trying to create new behaviors, what we want to focus in on is that response phase, as I had mentioned. So if you think about how new behaviors kind of form and how new habits form, oftentimes it takes a lot of conscious thinking. And conscious thinking occurs in kind of the front part of the brain. It's called the prefrontal cortex. And this is the area of the brain responsible for complex thought. So when you first start off riding a bike, oftentimes this is where you're sustaining your thinking, right? Your mind's thinking about, how do I negotiate the speed? How do I jump on? How do I begin to pedal? Kind of making all of these pieces work in concert. But as you begin to rehearse or practice an activity, other parts of your brain begin to take over. For instance, the unconscious function of habitual behavior starts to be taken over by a different part, kind of a deeper part of your brain called the striatum. this starts to inhibit that front part of your brain, the prefrontal cortex, from the conscious thought, and it starts to make the experience habitual. So the more we begin to practice something, the more it becomes cemented into those neural pathways, and then different parts of our brain start to kind of take that over. So in preparation for this slide series, I came across this great PBS Digital Studio production on YouTube, and it talks about the neurobiology of habit. One of the examples that it presented was from a kind of industrialist of the early 1900s, an individual named Claude Hopkins, who was trying to market a new product which was called toothpaste, which was really novel at the time. And he had came up with this kind of new grooming ritual in 1918 and marketed this product called Pepsodent, right? So Pepsodent had all of the core components of what we look at in a habit. He was able to kind of develop the market around that by exploring the cue, right? The cue of having the fragrance of toothpaste, the minty smell of toothpaste, the behavior, the habit and the response of brushing one's teeth, and then the reward of having that fresh breath, because it became socialized and kind of a known social entity that a clean and a smile that had used Pepsodent was more socially desirable. So it had all of the kind of cues of that habit loop built into it. And you can see that, with time, a lot of other activities really kind of respond in that similar kind of breakdown. So with habits, another piece that we want to be really kind of thoughtful of is becoming intentional. So this is really how new habits form. When we're starting out with behaviors, oftentimes, again, behavior takes a lot of energy, a lot of thinking about starting something new. So, for instance, take the notion of beginning or learning how to play a new instrument, right? It takes a lot of thought. It takes a lot of sustained attention. When we're becoming intentional like this, oftentimes it takes up mental and emotional resources. But we have this self-reflective capacity. We can think about what we're doing to make modifications over time. And as you think about the idea or the art of practicing an instrument or learning how to play a new instrument, with time and with sustained intention, that then becomes second nature, and it becomes rehearsed in something that becomes habitual. So the energy spent with affect and cognition are reduced within that. But the first couple components, which I'll talk about a little bit later on, it will be that we need sustained attention or mindfulness to really kind of generate new habits and kind of new behaviors. All right, next slide. So this is one of our first polls, and the question here is, what is the first step to creating a long-term change? And we have a couple choices. So building a habit or building a routine. And I'll give folks about 60 seconds to respond to that, and we'll see what is correct here. We'll give folks just a little bit longer here. And as we think about it, we're going to transition shortly from, what is the difference between routine and habit to kind of what is willpower. So I see a good kind of amount of folks responding. We have 44 saying building a routine. We have about 20 saying building a habit. And we have a very astute audience here. So building a routine is kind of essential to building a new habit, right? We want to start out with those discrete new behaviors, create a routine that starts to kind of build that structure around that habit, and continue to rehearse it through that habit loop to eventually cement that into final practice. So I'm going to go to the next slide here, which will kind of cap us at our poll. Again, building a habit, we had about 35% said building a habit, but actually building a routine is kind of that key element that we look for in creating habit. We need that routine before habit kind of takes place. So thinking about this on the top, we can relate to that Pepsodent example. It becomes habitual. We feel weird if we don't brush our teeth in the morning or night. Sometimes once it's kind of habituated. But starting a new behavior like running, right, takes a lot of sustained effort. So we have to create a routine. Sometimes reminders, sometimes external cues and prompts to actually get us pointed in the right direction. So routine versus habit. A habit is a behavior done with little or no thought, while a routine involves a series of behaviors frequently and intentionally repeated. A behavior has to be regularly performed routine before it can become a habit at all. So, going back to the poll and going back to the audience, you guys are spot on that routines are essential for the formation of habits. And as we begin to think about what habits we want to create, we want to build routines that begin to support those pieces. So let's talk about some of the principles of change that are really important to creating a new routine and sustaining a routine, right? So first of all, a lot of the behaviors that we participate in might not be obvious, right? So thinking about good diet and exercise, sometimes we conduct our day-to-day content without conduct without being cognizant of what is important and how it's obvious that we can begin to manage our diet or our food intake or our exercise regimes. We want to make whatever we're trying to change kind of explicit. So it's good to start off with defining what you want to create as the new habit or the new routine. The second principle of change is exploring how you can make that change more attractive. So oftentimes, and we'll talk about this more when we talk about some of the SMART goals, it's thinking about how can we reinforce the experience of creating this routine and how can we remove behaviors to the best of our ability. So thinking about things that are inherently reinforcing, things that are gratifying. So with physical activity like the endorphins and the dopamine associated with getting a really kind of positive exercise. With diabetic management, thinking about the positive outcomes of seeing our metrics of either the A1C scores change or our resting blood glucose scores change over time, those can make the activity more attractive. And another piece of what we want to do is think about how that relates to some of our core goals and what we want to achieve kind of more globally. So whether that's an improved quality of life or improved functioning, those are things that we want to continue to kind of keep in the front of our mind and reflect on to keep that routine and keep formation of making a new habit attractive. Another principle kind of after finding out how to make it attractive is how to make it easy. And this kind of relates to some of the pieces that I've alluded to. So how do we reduce barriers? So say, for instance, you're trying to quit smoking. One of the things that you're going to want to think about to make that easier is removing maybe the ashtrays from the environments that you reside, right? Taking and moving the ignition source, the lighter, away from the tobacco or nicotine. We can do the same thing with certain principles of diet associated with diabetic management. When you're shopping at the grocery store, creating a list and sticking to that list. Saying no to certain foods that we know aren't going to fit within our dietary budget the first time is easier, at the store as opposed to doing it when we're at home and frequently confronted it. So just thinking about what the shortcuts are to whatever the goal is that we're creating, how can you make it easier to engage in this principle of change? And the last part, how can you make it satisfying? So there are a lot of strategies to make some of these pieces satisfying. You have to be really kind of creative. So whether it's starting a new routine on a buddy system, having somebody really kind of hold you accountable, finding some way to kind of gamify this, again, looking at some of the positive outcomes and metrics for this, thinking about what is inherently gratifying for you and what can make this experience more positive. One of the final takeaways from creating habits is that there are no days off, especially with diabetes. One of the things that we want to think of is that with habits, those routines have to become consistent for them to kind of stick over time. And it takes a lot of sustained energy and a lot of sustained attention. And we don't want to kind of have lapses or relapses, but if we do, we absolutely want to get back on track, get back on the horse, and continue to try to focus on the mission and reflect on the pieces that are informing the habit or the new skill that we're developing. All right, so we're now at the stages of change part. I'm going to turn it over to Molly for her slides here.
Hello, all. Thank you for taking part in this discussion with us. One of the things that I want to kind of lay the groundwork with is that Andrew and I are both psychologists, and oftentimes that title can be a bit of a misnomer for folks where they really think about, the therapist who's sitting there with the patient lying on the couch telling them about, their mother and things like that. And really, our doctorate degrees are in the study of human behavior. So understanding how humans think, how they feel, and as a result, how they act. And so when I'm talking today about stages of change, and while Andrew's talking about how do we improve kind of behaviors that lead to long-term change, we're going to talk a lot about the science, but I really want you to think about kind of you as an individual and where you and your diabetes fall with this. And it's important to know that when it comes to making changes, not everybody's starting out from the same place. So back in the 1970s, a group was studying people who struggled with alcohol abuse and looking at why is it that some people who struggle with alcohol abuse are able to quit alcohol and remain sober for long periods of time, and why do some people have multiple relapses and may struggle with sobriety long term. And the researchers found this cycle that's now called, either you'll see it referred to as the trans-theoretical model or the stages of change model. Initially, it was 5 steps. Now we've expanded it to 6, but it helps us understand why some individuals are able to make changes a bit more easily as compared to others. And while it started out with alcohol abuse, we now know that this cycle really applies to any time people are looking at making long-term behavioral changes. And when I say behavioral change, I mean any big life differences where you're kind of acting on the environment. It could be something like a substance abuse, or tobacco cessation, but it could be weight management, medication adherence, or how you're able to kind of cope and manage your diabetes. So with this model, it was initially 5 steps that we'll go into more in depth in a second. But we expanded it out to understand that there was a 6th step that was involved, where we now see that relapse or lapses are a normal part of the change process that people go through. And so when Andrew started this presentation out, he asked you to think about why people frequently quit by the 2nd day of making long-term change. And now science has really shown that one of the reasons that people frequently quit is because they go straight to trying to make changes when really they might not be ready to. And so I'm going to go through some of the science, but I want you to think about if you're diabetic, where you are with your diabetes, or where you are with some other change you're trying to make, and which stage you're in. Because we now know that people are most successful long-term, regardless of what the change is, if they only try and move themselves from the stage that they're currently in to the next stage, rather than say I'm in contemplation and I go and see my doctor and my doctor's like, you have to make these 17 changes, and I move straight to action. That tends to result in people quitting very quickly. And so what I would encourage you to do is, when it comes to some area of your life you're trying to change, some area that maybe you haven't thought about wanting to change, but your spouse or your family has been like, hey, Dad, I really need you to quit smoking. Or, hey, Mom, I really need you to look at kind of reducing the amount of carbs you're eating. Where are you on this wheel, and how can you move yourself just to the next stage? What's a goal you can set for yourself, hopefully today, that would move yourself from the stage you're in today to the next stage, rather than attempting to kind of skip some of the steps and move yourself too far forward? So with that, this is kind of a pictorial version of what the stages of change look like. That really, it starts with awareness. A lot of times when we do go to make changes, it's not something that's been on our mind before. Potentially, if you're now diagnosed with diabetes, you hadn't really thought about your carb intake or maybe your BMI or your A1C prior to other people maybe pointing it out to you, maybe your doctor, maybe some members of your family. And it started to build your knowledge around that this could potentially be of concern for you. Once you're able to kind of build some of that knowledge in to really understand what are the pros and cons of making this behavior change, it might have affected your attitude towards it. So it's very common when people start to make changes for our attitude to be one of like defense, where you are absolutely anti it. You know, somebody brings it up and you're like, oh, not this again. But as we're continuing to gain more and more of that knowledge, we might find that our attitude and our perception of what's normal, what's healthy, what's good for us long term might start to shift. And it's normal for that to be a back and forth process until we're able to start making behavior changes and really starting to see that those pros of change outweigh the cons of change. So the first step of this model is that pre-contemplative stage. Here, people don't intend to make changes. Oftentimes, they don't see their behavior as problematic. They certainly see the negatives of making change as outweighing the positives. So if this was something like diabetes, this might be before you were diagnosed or in the early stages of your diagnosis, where the thoughts and feelings of having to pick your finger multiple times a day, of potentially taking a medication or inject yourself with insulin might just be too much, and you might kind of dig in your heels a bit and not be willing to make very many changes. The next stage that we want to see folks get to is that contemplation stage. This typically is when people start to want to take some sort of action sometime in the next 6 months. They might have not taken steps to make any changes, but they might start to see that there's some downsides to the behavior they're engaging in. So, for instance, if you've had a hard time managing your diabetes and people are asking you to make changes, this might be, well, you know, I've started to feel some neuropathy. I've started to have some of those, you know, numbness and tingling and pain that can go on, or I've started to see my A1C kind of creeping up there a bit, and you're starting to know that this might be affecting you a bit more long term. And you might start to see where the benefits of change are about equal with the drawbacks of change. Preparation is where we want to see folks take the next step to. And this is when people are beginning to take steps and they're going to start taking serious steps in the next 30 days. If you're thinking about weight loss as a goal, this is when somebody joins the gym, but not when they're quite ready to start going to the gym. They absolutely see that they need to make the change, that the benefits of making change in their life are going to outweigh the negatives. This might be where, you know what, I went to my history and physical and I found out my A1C was higher than my doctor wanted it. I made an appointment with them to talk about diabetes. That would be the preparation stage. You're gearing up, you're getting the resources to help yourself be successful when you reach the action phase. One of the kind of issues where we see people fail, again, is when they jump straight to action without making any of the necessary kind of plans, preparation, mindset changes that need to go on. that will keep people in the action phase long term. So this is when people are actively making changes. This is when you are going to diabetic ed, you are checking that A1C regularly, you're checking your blood sugars 3 to 4 times a day, you're buying the right foods, you're really shifting your life. And this is kind of that first 6 months, if you want to put a time frame on it, of behavior change. And multiple changes can be made over kind of this time period. It's not uncommon to see people make multiple changes as they're going through. Some of you may be in the maintenance phase. Unfortunately, it's in the maintenance phase that a lot of us get lax. And people, your doctors will have worked really hard to get you set up with your diabetes medication, to get you knowing the right foods that you're supposed to eat, to get you checking the right things. And then we kind of forget to provide support for folks. And so if you're in this maintenance phase, you really want to work on the motivation piece and keep yourself doing the things that you need to do. And I would really encourage you to plan for lapses and relapses and the triggers. So this works for substance abuse, but it works for diabetes too. When we think about kind of looking back in your own personal history, what were the times where your diabetes got a little out of hand? Was it times during high stress? Was it around the holidays? Do you know that when it's, so-and-so's birthday, that you're going to have some cake, but then that one day of eating cake threw you off for a week and a half? We want to start to prepare for those things we know could trip us up and have a plan for how we're going to kind of get back into either the action or the maintenance phase. And finally, relapses and lapses. We used to think that this was something everyone could avoid, and that's the ideal standard, is that we don't hit this phase. But it's also important to know that we, especially within psychology, see this as a really normal stage of the stages of change model. We anticipate that people aren't going to be perfect for the rest of their life. And it's important to know that there's a difference between a lapse and a relapse. A lapse is kind of one instance over a short period of time. Okay, so you had cake that you probably shouldn't have had at your friend's birthday party. And maybe that wasn't part of the plan and it kind of threw your blood sugar off for a day or two. That's okay. What we want to avoid is having one bad day that then leads to a month of bad days. A month of bad days is a relapse. And that's slipping back into those old kind of problematic behaviors. And the most important thing, whether it's a lapse or a relapse, is that you re-enter the cycle again. So with that in mind, I'm going to take us to our next poll, which is, I have to move my box here. Is a lapse or a relapse of an old behavior, of those old habits, considered normal? And I'll give people some time to take advantage of this, get some early participants. And it's important to know, with this, that it can feel pretty shameful for folks if you're having one of those lapses or you're having a relapse. And sometimes it causes us to avoid seeking out medical attention. We might avoid checking our blood sugar for a couple of days because we know that we did some eating that maybe we shouldn't have. And I really want folks to know that, yes, absolutely, kind of getting us to, technological issues, there we go, taking us out of this, that a lapse or a relapse is absolutely a normal part of this cycle. The most important part of it is that we re-engage into that cycle once we've had that lapse or relapse, and that we're kind with ourselves when that happens. And so along with these, and to kind of transition us into Andrew's next section, I want you to take a minute. If you go down to those red boxes, it is one of the middle ones. To me, it looks like a deck of cards. And it says resources. And if you click in there, if you haven't already, there's a handout called values clarification. And if you want to bring that up, if you don't have, this ability, or if you didn't bring it up beforehand, you can jot it down on a normal piece of paper. That's just fine. But I want us to take a look in that handout on that left-hand side. Take a couple minutes and just for yourself, think about when you think about your life, when you think about, yourself outside of diabetes, what's most important to you? What are the things that you value most? And we're just going to do that left-hand column first. For me, if I was to fill this out, my family would be up there. My career would be up there. It might be for you, your religion or your culture or your best friend or your dog, whatever it is. What are the values or things that are most important to you? Maybe it's things more like being a good person or living a healthy life. It really is an individual experience for everyone. And then while you're doing that, on that right-hand side, when you think about that value, how does this relate to your health and well-being? And so when you think about, giving my top one, if I put my family as my top value, how does that relate to the behaviors I engage with related to my health and well-being? Because when we reach that maintenance phase, it can be really challenging on a day-to-day to make those small decisions that align with our values. And so it might be one of those things where you're like, well, my blood sugar has been running in the 200s, but it's fine. Well, if my top value is my family and being there for my family, maybe I'm remembering that I want to make it to my granddaughter's high school graduation. Maybe I'm remembering that I want to be able to be more active with family members. Maybe I want to make sure that they, don't need to be as involved in my healthcare, whatever it is for you. But think about how your day-to-day behaviors either pertain to or don't pertain to your kind of core values. And potentially when you're setting goals for yourself, this might be a page you can print off and stick on the refrigerator for yourself. Put someplace that you're going to see frequently so that you can take a moment for yourself and say, you know what? This is a momentary decision that I'm making that does not align with my values. Or making that call into my doctor because I haven't seen them in 8 months is aligning with my core values. That is a change I want to make for myself. And so kind of keep that in mind while Andrew's talking about goal setting.
Great. Thank you, Molly. I think that really sets the stage nicely for kind of exploring goals because, as we've kind of worked up to this point, we want to make sure that the values are informing, the goals that we're participating in. So I'm going to walk us through an acronym, and this acronym is for SMART goals. Some of you folks might have heard of this. Some of you may already participate in it, but I'd like to just at least kind of introduce and review it for those who haven't. I think it's a nice exercise. So as mentioned, SMART goals are an acronym. We use this a lot in the world of behavioral change and psychology. And the acronym breaks down to specific, measurable, achievable, relevant, and time-bound. So we'll start with the first piece of the SMART goal acronym. And all of these are in spirit of setting good goals that we're going to achieve, based on the values that you've already developed. So one of the things I know that I'm bad at, and Molly can probably attest to this, is eating green vegetables, right? I don't follow the USDA recommendations from my plate. I'm really bad at this. So thinking about a general goal, I could say something like, I really want to increase the amount of vegetables I'm eating in my day-to-day. But that's rather unspecific and might not help me set that new behavior or new routine in a way that sticks or that sets me up for success. So what I want to do is maybe get a little bit more specific about it. And specific goals are met more often than non-specific goals. Specific goals really answer the W questions, such as who, what, where, when, and why. So let me give you a specific version of I need to eat more vegetables as a goal. So I, Andrew, will consume 3 cups, 8 ounces per each cup of vegetables. That's the what? 5 times a week for the next 4 weeks, beginning July 1st. That's the win. And where will I do this? At home and at work to meet the MyPlate USDA recommendations. So thinking about how specific you can make your goals, whether it's to diabetes or whether it's to learning a new skill, this is kind of step number one and really important to making sure that those goals stick. Part number 2 in the SMART acronym is measurable. Whoops. Let me go back to measurable here. So part number 2 is measurable. So what we're looking at with measurable is establishing concrete criteria for measuring progress towards attainment of each of the goals, such as maybe how much, how many, and how will you know something has been accomplished? How will you know when your goals have been met? How will you measure your success? So in the previous example, the way that I would know that I've been successful is if I meet that mark of 5 times per week, meeting the 8-ounce, 3 cups of vegetables in each day for the next 4 weeks. So the really measurable piece here would be the 5 out of 7 per days out of the week for 4 weeks. So I want you to think about, based on your values, are there any goals you want to set? And, how specific can we make that? How measurable can we make that? And we'll continue to go through the rest of these. So the next piece here is going to be achievable or attainable. So for attainable, we also want to really set realistic goals. So based on the present restrictions, such as your schedule, what consumes your day-to-day life, your workload, your knowledge, you want to set something that is within your abilities. So you want to start to think, what will help you achieve this goal, and how can you reduce barriers? What are some potential barriers and pitfalls that might block your progress, and how can we plan for these accordingly? So as we start to think about planning, we're also going to talk about pitfalls towards the end of this series. And this is a good time to start to kind of preemptively map out what pitfalls might exist. Am I not being mindful of the types of food products I'm purchasing? Am I mindlessly, watching television, movies, Netflix, or on screen time? What are some barriers for me to kind of reduce to achieving my goal? Let's move to the next one. So the next piece here is thinking about how relevant or realistic a goal is. So I like to use the adage, Rome wasn't built in a day. So we want to be somewhat realistic and relevant here. We want to aim high, but we don't want to aim so high where we're setting ourselves up for failures. We'll start with smaller goals and work up to the bigger ones, piece by piece. We'll consider goals that can be accomplished reasonably given your individual circumstances. So, for instance, I'm a fairly fit individual, but if Molly was like, Andrew, I need you to run a marathon tomorrow, I would fail miserably. But however, I could probably run a 5K by next month, with a little bit of effort and energy and training, and maybe a 10K by August when the Crim Fitness Race in Flint commences. And maybe if we plan kind of long term, we could do a marathon by the end of the year. What you want to do is really kind of set this up to be relevant and realistic, so you're not overwhelming yourself and kind of sabotaging your new habits, behaviors, and routines from the beginning. We want to make sure that this sticks. All right, and then the last piece of our SMART acronym is thinking about our goals as being a time specific or time bound. So a goal should have a time frame or a deadline for completion. You want to determine a reasonable timeline for your goal. Do you want the goal to begin this week, next month? In my example, I had mentioned July 1st, sometimes starting fresh at the beginning of the month, or, at a certain kind of set point can help us really kind of hit the reset button and start kind of anew with this goal. In addition, setting time-bound goals ensures some level of accountability for us. This allows us to check progress and set new goals as time progresses. It also motivates us to take action. And kind of the inverse, when you don't set a timeline, there's no internal pressure to accomplish the goal. So oftentimes this gets backburnered. And as a habitual procrastinator, I can tell you that, the tasks of our day-to-day life kind of expand to the amount of space we provide it. This came from a researcher in the 50s called Cyril Parkinson's, and this is Parkinson's law, not the disease, but the kind of law of human behavior that work and tasks expand to fill the time allotted to a specific endeavor. So this is why sometimes we get sidetracked on our goals or distracted by the rat race of life. But setting more kind of time-bound parameters around this, setting more kind of explicit details around the time, and being smart in our goal development can help us be more successful in the long haul. All right, so I now want to kind of explore some of our strategies for success. This is the secret sauce of the recipe of routines and building habits that are really lasting. So so far we've talked about rehearsal and kind of building routines on behaviors and continuing to practice those behaviors until they stick in some regards, and how to be explicit and smart about those, how to align them with our values. But what about some other elements in kind of developing habit and routine? So one of the big other pieces that we want to think about is motivation. So one piece with motivation is that we know that motivation is finite, that there is a limited amount of motivation that all of us have, right? When we make too many decisions, we can develop decision fatigue. When we go, at that time, we often go down the path of least resistance and kind of abandon our plans, or abandon, what the best choice for us or the healthy choice might be. So to kind of circumvent this or prevent this, we have various opportunities to engage in better habit forming strategies. And I'm going to introduce two of them here, and then we'll kind of talk about sub ideas for supporting strategies for success. So the first is cultivating more awareness. So developing or expanding our awareness is really important to kind of setting the course for new behavior development or breaking old behaviors. And when we're developing awareness and recognition of a phenomenon, we want to prioritize what is important to us. So I really like what Molly had said about printing out that values clarification and putting it somewhere where you're going to see it. Walking by the fridge, or putting it in a really visible place in your office, or wherever it may be. You really want to be have those values kind of hit you in the face when possible, so you continue to kind of be aware of that goal setting process. And then two, we want to start to think about environmental engineering. So that's a fancy term for kind of changing your environment to meet the needs of a new behavior that are in line with our values. For example, when I had talked about quitting smoking, thinking about some of maybe those automatic cigarettes, thinking about some of the strategies of separating the distance between the ignition source and the tobacco, or making things more explicit and obvious, right? Having your glucometer right front and center. So, when you're ready to check your blood sugar, it's kind of right there and speaking to you, and kind of, you can't miss it. So the more barriers we can reduce, or the more barriers we can put in place for unwanted habits, the more likely we are to break those habits. The more barriers we reduce for new habits that we're trying to achieve, the more successful we are with kind of developing new habits. There's this great clip on YouTube that talks about the 20-second rule. So Sean Aker is a researcher and has studied ways to kind of make habits stick. And one of Aker's kind of principles is the 20-second rule. So lowering the barrier to build positive habits only takes 20 seconds, right? So if we are able to reduce the time in that habit loop in between the cue and the response to 20 seconds, we're much more likely to kind of cement that behavior into a habit and have it become automatic. The same thing is true when we're trying to break bad habits. If you can create a barrier of 20 seconds in between your kind of craving and that response time, you have a higher probability, a higher likelihood of breaking that bad habit, whether it's slowing yourself down from, eating something that you shouldn't or engaging in a behavior that you shouldn't, creating some sort of buffer of time. That 20-second rule can be really helpful. All right, I'm going to go to the next slide now. Some other pieces of what is important for the secret sauce of success include controlling what you can. So this connects with willpower, really kind of tackling one task at a time. And one of the things I kind of think about when I think about willpower is the Stanford marshmallow test. So for people who are not familiar with the marshmallow test, Walter Mescal from Stanford University conducted a test in the 70s using 4-year-olds, and the test was deceptively simple, right? So he put a marshmallow in front of 4-year-olds and said, if you wait 15 minutes as we walk out of this room, before you eat this marshmallow, we will give you 2 marshmallows. But you can also choose to eat this marshmallow and you wouldn't get a second marshmallow. The outcomes of the marshmallow test found that 10 to 15% of 4-year-olds, and most of us, inherently have this kind of overdeveloped willpower where we can wait for gratification, so we can get the positive rewards. I would say habits are very similar to the marshmallow test, where if we're delaying gratification and practicing this new behavior or this new routine, we're much more likely to have the positive reward similar to that second marshmallow. In Mescal's study, he followed these 4-year-olds at multiple points. He looked at them at the 5th grade level, at middle school, high school, college, post-college, and he found better outcomes across the board for these individuals. He found that these individuals were oftentimes more popular, had better scholastic outcomes, had better relationships as they were married longer, had higher paying jobs, more financial security. And what he found was that there's a variety of mental strategies and techniques that we can use to really kind of increase willpower. That it's not just an innate quality, it's something that we can learn over time. And that determination is really the single greatest correlate of success. So the more that you can define these values, the more that you can begin to kind of put them into those SMART goals to rehearse as a routine, the more successful you'll become. But the key component is to not give up. To continue to kind of strive for continuing to move towards those goals and values. So other big components of controlling what you can, communication is important. We talked about focus with the willpower. I want to focus on communication. So communication can be important for a variety of reasons. First and foremost, most behaviors are conducted in context. We had talked about routine being context and situationally specific. So to break that, oftentimes we want the support of others. We want to kind of marshal the support of our support systems. We want our family and friends to be aware of what we're trying to achieve so they can also say, this is a good idea or not a good idea. They can help us be accountable. And really communication helps with our accountability, right? So letting people know what our goals are allows us to be a lot more successful because we have the social pressure and we have the social support of those individuals in our environment. And then the last piece, as we've kind of talked about, I won't belabor the point, but controlling what you can, goal setting is a huge component of this. So relying on personal motivation based on the values that we had talked about before, taking these one step at a time and being kind of supportive and gentle with yourself, right? Focusing on behaviors, not just the numbers of outcomes. We want to think about the entire kind of circumstance, the entire situation. Whether you have positive changes in quality of life, if this is kind of aligning with the bigger goals, are you spending more positive time with family? What other positive outcomes are coming from these goals? All right, some other life hacks and ways to kind of improve making habits stick include stacking your habits. So what does stacking your habits mean? This is a finding from the British Journal of Health Psychology, and what they discovered was a phenomenon called piggybacking. And essentially, what piggybacking is they found that people trying to get into the habit of something are more successful if they connect it to an established habit. So, for instance, flossing your teeth could be piggybacked on the habit of brushing your teeth. And seeing as you've already had the habit of brushing your teeth, you're going to be much more likely to be successful flossing than just trying to do it independent of brushing your teeth. So pairing the two of them together can be really helpful. But typically the sequence of those, the stacking has to occur after the already established habit. So the brushing of the teeth usually happens, then you have to do the flossing. So the same thing can be true for your diabetic management, whether it's medication adherence, whether it's participating in new forms of physical activity, whether it's the checking of point of care blood glucose. All of these can be stacked onto other activities, whether it's stacking them onto current behaviors like exercise or current meals. Kind of connecting them to routine is the idea here. All right, next slide. We also want to think, as I had mentioned, beyond a number, that you want to think about the big picture of what the outcome could be. So going back to the stages of change, when I work with our diabetic groups here in Flint, we have really kind of established cohorts of diabetic patients that have been together for a long period of time, and they really know what to do for taking care of their diabetes. One of the things that they run into from time to time is this maintenance phase in the stages of change and really hitting plateaus, right? So not seeing progress, just being really stable, but they're putting in a lot of effort, so they want to see a return on some of that effort. So what we encourage those folks to do if you're hitting kind of that plateau or maintenance phase is to begin to think beyond the number, begin to think about how this connects to the broader goals, to think about what other positive outcomes are coming from your current changes and the healthy lifestyles that you're adopting. All right, so final pro tips for making habits stick before I turn it back over to Molly for talking about avoiding some pitfalls. So pro tips. This is kind of a short list from the site Lifehack, but these are scientifically validated and have backing from psychology. So the first one is commit to 30 days, right? It takes time to really build a habit, and habits can be variable. What the literature shows is that forming a new habit can really depend on the individual and the context, and can vary anywhere from 18 to 250 days. But the most average kind of timeline for making a habit stick is about 30 days. So this is 3 or 4 weeks that you need to kind of really focus in on making that behavior automatic and continuing to rehearse it as we had talked about. That's a good way to make it stick, is commit to it to at least 30 days. Pro tip number 2, make it daily. So consistency is critical if you want to make a habit stick. If you want to start exercising, go to the gym every day for the first 30 days. Going a couple times a week is invariable, and it makes it harder for that habit to stick. Activities that you do only once in a while oftentimes don't click. So one of the habits that I'm trying to create right now, we have a brand new screening system for COVID here at McLaren, where employees have to fill out a survey every day to make sure that we are cleared for our shift. And this is done through a digital link. But when I get to work, my mind goes to all these tasks I have to focus on and checking my inbox first thing. So the habits that I'm trying to kind of really commit to is kind of daily queuing in, filling out the survey each and every day. So I've changed my office environment to have prompts and cues like sticky notes to say, hey, have you filled out the survey today, to make sure that this habit is sticking and becoming routine for me. Pro tip number 3, start small, start simple. So we had talked about this in the SMART goals. We want to start things that are really realistic and achievable. And after you have that initial success, we can continue to build off that initial success. So don't try to completely change your life in one day. Really unrealistic, right? It is easier to get over motivated and take too much on, and then you get discouraged and abandon whatever you're doing. So if you want to make a change, first make that habit in small increments. Go for something that's achievable, something that you can knock out of the park, and then once you have success with that, begin to kind of expand it as you continue to experience success. Number 4, we had talked about this, get a buddy, ensure accountability. So I really am a big proponent of the buddy system and starting new habits or quitting unhelpful habits. And, when you do things with peers, sometimes it's helpful to have their encouragement. Sometimes it helps it kind of say, again, that social pressure is there to help hold you accountable. Number 5, be imperfect. So I'm not saying, set yourself up for a failure, but don't expect all your attempts to change habits to be successful immediately. This goes back to the point that Molly made, that part of the stages of change model really saves some space for lapses. We want to avoid relapses, but we know lapses can be part of the process. So if it takes multiple tries, continue to get back up on that horse and kind of give it your best shot. Be logical, try to figure out what went wrong, and try to kind of problem solve about where to go next. And the last couple pro tips here: remove temptation. So restructure your environment so it won't be tempting in the first 30 days. Remove junk food from your house. Cancel cable subscriptions. Throw out the things that are maladaptive. This will help you, both have that willpower. It'll help kind of support that willpower, and it'll help you be successful in the long haul. One of my favorite ones is Swish. So visualize your success. This comes from the sports world, and it's a technique from neuro-linguistic programming. So when you visualize success, you're more apt in participating in behaviors that'll lead to that success. So visualize yourself performing the habit. Continue to rehearse it in your mind. Visualize yourself pushing aside any bad habits and performing, the alternatives. And then, really kind of see yourself in that positive state. Know what it'll be like. See if you can kind of hypothesize what the reward will be like. So you're more encouraged and more motivated to participate in this behavior. And then the last piece here is reinforce yourself. Be assured whatever the change process is that you're doing is for yourself and for the values that you've created. Don't worry about all the things you should have as habits. Think about things that are going to reinforce the desire to participate in this, and think about the positive outcomes. If positive outcomes are hard to find, think about things that are closely related that could reinforce the positive outcome or the behavior. I know our restrictions are starting to open up from COVID. Maybe things like going out to share a meal, or going to the movies, or some sort of social function, or something that brings you satisfaction or pleasure. Going for a walk in nature. Those are all things that you want to build into your change and habit routines. All right, I'm going to turn it back over to Molly, and we will talk about some avoiding the pitfalls.
All right. So with avoiding pitfalls, it is expected that you are not going to be perfect. And I think that really needs to be the first step that we look at, is that we can be really, really harsh on ourselves when it comes to things that relate to our physical health, that we go to the doctor and we have to show them our number logs, and that there are going to be those ups and there are going to be those downs. And that is expected, and we should kind of expect it for ourselves. What we don't anticipate is that success is kind of this straight shot up. Rather, it's kind of this, back and forth. But as long as we're moving in the right direction, that's really where we need to place our emphasis. I'm going to skip our polls for the sake of time here. But what's important to know is that chronic medical conditions do not only affect our physical health. This is kind of an old adage that it's just the body, so why can't you kind of cope with it? But our brains and our bodies are absolutely connected and affect one another. And so what we know is that managing diabetes is hard. It's not fun to have to prick our fingers every day. It's not fun to feel that fatigue. It's not fun to have all of those barriers placed on our life, and it affects us overall. Not just that, but there are physical consequences of having diabetes that do make it harder for people to maintain a positive mood. And so what we know is that for kind of all chronic medical conditions, but for diabetes specifically, those with diabetes have a higher chance of having both depression and anxiety as compared to the general public. It doesn't mean that it's a guarantee, but it definitely means that it's something we have to kind of make a conscious effort for improving overall, and for making sure that we don't slip into those kind of real dark, deep places, and then to know what to do if we do. So stress and distress are expected with diabetes. And so stress is kind of an uncomfortable feeling that we experience due to something that's happening in our environment. And sometimes stress is something we experience cognitively. So that might be, it's hard for me to concentrate. It's hard for me to remember as compared to when I didn't have to manage my diabetes every day. It might be an emotional thing. You feel anxious all the time when thinking about your diabetes. And sometimes it's physical. So what we found is that when people are feeling really stressed out, it's really common for them to have neck and shoulder pain because you tense those muscles, or to get more headaches, more stomach aches. It can absolutely be a physical thing. So how does stress affect you? Think about how it affects you, and that can give us a good indication of how we should try and cope with it. Stress and distress can be a normal part of having a chronic condition, but when it's happening every day, when it's happening for weeks at a time, that's an indication that we should step in and try and do something kind of more long-lasting with it. And so what research has found is that distress has been independently associated with blood glucose. So legitimately, when you're more stressed, it can directly affect what your blood sugar is coming in at. And that can also lead to us getting burnt out and not acting like we need to take care of our health. So it's important to kind of try and intervene when something is at a stress level as compared to when it reaches maybe a depression or anxiety level. So distress or stress might have, we feel stressed out, we feel worried, we might feel overwhelmed. It could reach the level of burnout. So stress is kind of a momentary thing. Might be a couple hours, might be a couple days. Burnout is a little bit more long lasting. So when we're feeling burdened by life, when we're feeling overextended, this might be relating to your diabetes. It might be related to your job. It might be related to COVID, right? We're all feeling a bit burnt out from COVID. And it can lead to us feeling like giving up. However, depression or anxiety is when it meets diagnostic criteria. And that may or may not be something that we should seek out treatment for at that point. And so kind of trying to keep us on time here. What's something that you can do in those early stages? How do you manage that stress and distress? Look at rewarding yourself for doing well. If you are kind of tracking how you're doing, say, I promise to, going back to SMART goals, I'm going to set the goal for myself that I'm going to check my blood sugar at least 3 times a day for the next 30 days. And I'm charting that I'm doing that on the calendar. At the end of that 30 days, if I have met that goal, what am I going to do for myself? And in America, one of the things that we really struggle with is that oftentimes we reward ourselves with food. And this can be a really challenging habit to break for ourselves. And so what are some ways that you could reward yourself that are not food-based for doing a good job. Create a positive atmosphere for yourself. Reevaluate not just what it feels like I've lost due to having diabetes, but what are the steps I'm actually taking back ownership of and gaining in my life by taking control of my health a bit. Making sure that, we recognize that exercise is one of the best antidepressants on the planet. Research has shown it's a very, very effective antidepressant, and it's very important when we have diabetes. And self-care, it's not just a trend, it needs to be done every day. And so really thinking about what things can I incorporate in my life that make sure I don't kind of treat stress and distress so that it becomes those more long-lasting, more diagnostic difficulties. We want to look at slowing down, setting goals. You might have to take a break from things. That's normal. That's okay. It's important to know what we can and can't step back from. We can't step back from checking our blood sugar. We can't step back from taking medication, but I might need to step back from some of, the social engagements. I might need to step back from some of my work responsibilities and kind of recognize what you're able to manage on a day-to-day basis. Do something good for yourself that feels, great, that rewards yourself, and do it every day. People will tell you, I don't have time to work out for 20 minutes a day. I don't have time to fill in the blank. But if you're not taking care of yourself on a daily basis, it's going to lead to more long-term outcomes where we're not able to do the things that we need to do long-term. Get back to your why. So go back to those value clarifications. If you're feeling burnt out, if you're feeling overwhelmed, kind of take a look back. What am I doing this for? Am I doing it for my family? Am I doing it for my religion? Am I doing it for my cultural values? Am I doing it, for myself so that I feel good? And get back to those reasons and remember why we're trying to take care of ourselves in the long run. And recognize when you need help. Hopefully having Andrea and I here has at least dissuaded you a little bit that shrinks aren't all that scary. We like seeing our patients. We like helping. And it's okay to say, hey, I need some help with this. That could be medications. That could be therapy. Both are very effective together, but either one can help out. Reevaluate your relationships. Relationships have been scientifically proven to be one of the best anti-stress things out there, but also one of the things that can stress us out most. So look and evaluate your relationships. What's healthy? What's unhealthy? And make some of those, decisions. We encourage people to use I feel statements. So rather than you made me angry when you fill in the blank, to say I felt hurt when you weren't supportive of what I have to do for my diabetes and for my health. And again, please, please, please feel comfortable to ask for help. Learn when you know you need. So when it's not those kind of, I just had a bad day. Bad days happen to everyone. That's okay. But if you're looking back and you're like, you know what, I've been really burnt out for the past 2 months, that's a good indication that you should maybe consider asking for help. The question we get frequently is medication, therapy, or both. Research has found that it's most beneficial when somebody engages in both therapy and takes medication, but that therapy as compared to medication are essentially equally efficacious for most things when it comes to things like depression, anxiety. And that, so again, 2's better than 1, but either one is more beneficial than doing neither of them. And so just for the sake of time, I'm going to get us to where we're happy to field any questions, comments, and welcome your input. And while we do that, I am going to keep our contact information up on the slides so that if you have any, more direct questions, you're welcome to reach out to either one of us. And we thank you for having us today. Wow,
that was a lot of really great information. I think that I'm seeing some of the comments coming in the chat, and it's pretty funny. We have some questions, not a lot. So I say to our audience, if you have any questions for the doctors, please put it in either the Q&A box or in the chat. Paul just asked, Dr. Andrew, is that snack consisting of a green vegetable? Appreciate all the info today.
I'm wondering if you caught me through a piece of gum and my mouth was dry, so I needed something to use some of the saliva to continue to talk. So it is not a vegetable, but it is on the list. Thank you.
All right.
I
so
will
one of the very first questions.
Sorry,
Go ahead, Molly.
He's overestimating. He thinks he's going to make it to three cups of vegetables, but he doesn't know this yet. We're having salads for dinner tonight.
I do that to my husband too. So one of the first questions that came in, actually before we even started, was from Patricia asking what the correct A1C score is, 6.5 or 7.0 when diabetes is concerned.
So great question. To preface this, I'm not a medical doctor. I'm a psychologist, but we do work very closely with those metrics. 6.5 is typically the cutoff for diabetes. We do see some concerns with pre-diabetes, prior to that. So that's one thing that we work with our clinic patients here is kind of being mindful when they're encroaching on that score.
All right. So we have a question that David sent in. Or wait a minute, I lost the question. Where did it go? Here we go. Yvonne asked, "How do you keep yourself from self-sabotage?" Excellent question.
Excellent question.
Yeah, I think that's a great question. And, I think Andrew talked a bit about kind of the awareness piece. And so I think that the awareness that you are one of those people that may engage in some of those self-sabotage behaviors is really, really important to know. And I would say when we're looking at making long-term changes, is trying to make less long-term changes at one time as compared to more long-term changes has been shown to be have better outcomes long-term. So choosing to change one or two behaviors at a time is much more likely to have better outcomes than trying to change 7 things at a time. And then recognizing where those self-sabotage behaviors really come in and putting those blockers in for yourself to make it harder for you to self-sabotage. And recognizing when you have those relapses, being gentle, but getting back into the behaviors that lead to long-term success. So you're going to have some of those self-sabotage moments, but saying, "Oop, that happened. Now time to get back in today rather than tomorrow. And if it's tomorrow, do tomorrow rather than next week."
Very good. Thank you. Rita asked about peer support groups for diabetes. And do you know if those are offered? We're starting to get back in person. I think it would be most helpful probably in person. But I know, Andrew, you said to a diabetes group. So I'm wondering, what do you know about peer support groups?
We know that they're incredibly efficacious, that they have been successful. Unfortunately, my knowledge outside of Genesee County is a bit limited. I know here at McLaren Flint in our residency program, we do have a very consistent diabetic management cohort, and it's a shared group visit model, which is really cool. We bring our dietitianists, we bring our behavioral health specialists, and our primary care docs all into the conversation, with these peer support groups, and it's been really beneficial. But outside of that, I don't have a ton of resources, unfortunately, for the state. Molly, do you have any idea?
What I will say is that, what I was going to say is that, so a lot of it is based on your insurance. So step 1 would be making sure that you're seeing a provider that works with your insurance company. So sometimes insurance groups will offer peer support. Another one to look at is to contact your primary care doctor directly, or if you're working with an endocrinologist, talk with your endocrinologist directly, and they'll be able to tell you what support groups are offered in your area. That's true for diabetes, but it's true for a lot of other things. Most hospital systems will offer a number of support groups. I can say for McLaren Bay, we have Diabetic Ed that meets like once a month here. But it really is kind of based on your geographic location. And so your primary care doctor would be a great place to just call the office, and they should be able to provide you with what's within driving distance of where you live.
All right, excellent, thank you. Kathy asks, how often should she have her A1C checked? I know you're not the medical doctor, but do you have an answer for this?
Yeah, so an A1C is actually a 3-month rolling average of diabetes score and outcome. So I would defer to your primary care doctor, but it is that 3-month average. So usually if it's within a 3-month span, you have a pretty good sense of your performance over that time horizon.
All right. So I have a comment from David that said, thank you. I used these exact principles to lower my A1C from 10.3 in 2017 to 4.9 in 2019. So
awesome. Good work.
Your principles work. Everything yeah. So, all right. Just looking for the various things. So Trina asked, is there a limited amount of willpower one person has? You use it up when you're trying to control behaviors. Do you use it up when trying to control behaviors?
Yeah, so it's complex. So limit is kind of an interesting term. I did say there is a limited amount of willpower. And what I meant by that is that we have a limited amount of cognitive and emotional resources, right? That if we try to exceed that, information falls outside of our awareness, and oftentimes we take the path of least resistance. So as human beings, we don't have like a set amount of willpower that once we use it up, it's gone forever. But similar to like a garden hose, right? Once the hose is fully expanded, there's no more room for more willpower to go out. So that's why we want to be really proactive in kind of creating an environment that supports these new routines and new habits, and instead of trying to be reactive and trying to kind of push more willpower and force through that limited bandwidth, if that makes sense.
And the way that I kind of picture it is that not everyone has the same initial psychological piggy bank.
Yeah.
And so you can think of kind of your emotional well-being as a psychological piggy bank. And based on your history, do you have a history of a really supportive family and good relationships and good sleep and good, all of that, that means you have a really full psychological piggy bank. You might be able to make a lot more deposits from that psychological piggy bank. But if you have a history of maybe you went through a really traumatic experience, or you had a rough childhood, or you've just gone through a divorce, or things like that, your psychological piggy bank might be pretty empty. And so you might not be able to make the same amount of deposits that other people might be able to make without having consequences. But that doesn't mean that you can't put deposits into the piggy bank at the same time to really help yourself kind of cope long-term with your diabetes. But you might, depending on your background, you might find it easier or harder to kind of make those withdrawals or to put deposits in.
That's very interesting. That's very interesting. All right, there's a couple things that I want to address really quick. We've had a couple people ask about watching this presentation again, or watching any of the previous diabetes presentations. And yes, you can watch them again. This one, it'll be a few minutes afterwards, but you can use the same link. You will also get an email. The link will be in the email that you get shortly after this presentation, and you can watch it again. It'll be available for, I can't remember exactly how long, but at least a month. The other ones, you can go to our an AARP Michigan website and click on virtual events, and you will find those links for those on the virtual events website. Alicia asks about needing hands-on workshops for cooking. And Alicia, you're in luck because we are planning some of those for the fall as sort of a follow-up to this diabetes series that we're doing. So stay tuned. Keep an eye on the AARP Michigan Virtual Events page and for those. So I know we're planning at least 3 of those. So we are about 4 minutes over. I'm going to see if there's any other quick questions we can answer real quick.
Can I answer one of them that I had?
Yes.
That I think applies to a lot of people. So someone had asked, the stressors I struggle with come largely from many large-scale and existential challenges we face as human beings. Can you offer suggestions for finding some sort of balance between addressing those challenges while also maintaining individual health? And I think that I really like this mindful question that someone asked. They said by existential, I mean like environmental degradation and racial justice, etc. But I think that experience is a very wide-reaching one that I think probably a lot of people have faced before. Maybe not the social justice piece, but you might have had a history of trauma. You might have had a history of family difficulties. And I would say when you're having those bigger questions, those bigger struggles that you're working with, and you have to cope with a chronic medical condition, that is the perfect time, if you feel comfortable, to seek out working with a psychologist, especially somebody who has a health psychology background. So both Andrew and I, that is our specialty, is we're clinical health psychologists. And so we have one foot in working with psychology, working with those existential crises, those long-term human experiences, and with working with those with medical conditions. And so if you're struggling with kind of both of those things at the same time, seeking somebody out who works with health psychology specifically might be to your benefit. That's a more in-depth dive. Obviously, what we talked about today is just kind of skimming the surface. Some of these strategies may help for kind of more minor things, but if you're kind of doing that deeper dive into those long-term things, working with someone one-on-one can be beneficial for you.
Thank you. And that's actually what I was the question I was going to ask right when you asked it, or addressed it. So excellent. So, all right. Well, we are over our time, and I want to say thank you to both of you for such great information. And we will I'm sure be doing diabetes series again next year, so we will hopefully have you back. Thank you for your time today, and thanks to our audience so much.
Thank you, Karen. This was excellent.
Thank you for having us.
You're welcome.
Times like these remind us of our dads, who always knew when we needed comforting and always knew what to do. The role models who shed light on the highs and lows of life and still had time to be just dad. Now that the vaccine is available, let's make this year's Father's Day one for the books. Let's make up for the time we couldn't spend with our dads last year and hug them like they're still the heroes they've always been. It's time to celebrate dads. Vaccines are bringing hugs back.